Hello everyone, this is Susma explaining in brief about robot used in robotic surgery from circulator nurse perspective. So this is robot and this is robotic tower. At the top is monitor. Below that there are two spots where different kind of gas tubing can be connected. Like we use Bovie cut regenerator in open surgery. This part of robotic tower acts as a power generator for bipolar monopolar electrosurgical unit. And this is where robotic cameras on stellar path is plugged in. Here on the side of robotic tower, there are two CO2 tanks, and CO2 gases are most often used in robotic surgery, and this is robot with 4 arms, 1, 2, 3, 4. On the back of robot, there is a display screen. As you turn on the display screen, you can see commands that says deploy for draping, stow, and enable joystick. And to the left there is a command called select anatomy. Click on that and choose one of the options according to the area of your surgery. Immediately at the bottom, choose patient right or patient left depending on which side of the patient robot it is standing during the surgery. Likewise, if we click on deploy for draping, robot will adjust its boom and arm so that we can drape robot with the sterile drapes. Similarly, to adjust height and position, there are two joysticks below screen. To enable those joysticks, we should click on enable joystick and move joystick at the same time. For example, click on enable joystick and move the joystick that says boom height upward to increase the height of boom or robot, or move the joystick downward to decrease the height. Similarly, there is another joystick that says boom position to move the boom right, left, forward, or backward. For example, here, if I move the joystick towards the right, the boom will move towards the right. And the important part of circulating is to drive the robot. Push in the thing in handle along with moving robot. You can see there is a manual operator at the foot of robot. So in the middle of case or at the end when the robot is disconnected and you need to put the robot together, click on stow. Now the robot will adjust its arm and boom accordingly. Similarly, how to move the robotic arm. So there are two buttons at the top and at the middle, as you can see in video. Push on those two buttons at the same time and you can move arm sideways or flex or extend the arm of robot. So after the surgery is done, click on store to store the robot in its designated space or area. One more thing, there is a red button which is for emergency stop. Also, there is a thing called surgeon console. This is surgeon console from which surgeon operate robot for surgery.
So these two things on the surgeon console is like an eye of surgeon through which surgeon look into anatomy on display monitor. Similarly, these are like a hand of surgeon on which they place their hand and manipulate the arms of robot for surgery.
On this surgeon console, there is a switch on and off button and also emergency stop button. And onto the left, there is a button which helps to adjust the foot system underneath the foot. And there is a foot system. That is it. Thank you.